In this video, I will show you how a subcutaneous pellet implantation procedure is performed in a laboratory mice. First, a small area on the back is carefully shaved using a trimmer. Removing the fur makes the surgical area easier to visualize and helps maintain appropriate cleanliness during the procedure. Before starting the procedure, the mice is placed under general anesthesia, typically using inhaled isoflurane. Appropriate pre-operative analgesia is also provided. For the pain management, eye lubricant is applied to protect the eyes from drying during anesthesia. The skin is thoroughly sanitized using alternative swab of betadine and ethanol. A small incision is then made in the prepared area using a sterile surgical instrument. This provides access to the space underneath the skin where the pellet will be placed. Next, a specialized instrument called the trocar is used to place the pellet into the subcutaneous space. Once implanted, a pellet remains beneath the skin, gradually releases its content over time. Depending on the formulation, this can provide sustained exposure to the experimental compound without requiring repeated injections. After implantation, the small incision is closed using appropriate sutures. Because these pellets are designed to dissolve or be absorbed over time, they generally don't require a second procedure for removal. Following the procedure, the mice is carefully monitored while recovering from anesthesia. Pellet implantation is commonly used research technique for delivering substances such as hormones, drug or experimental compound in a controlled and sustained manner. One advantage of this approach is that it can reduce the need for repeated daily injection and therefore minimize repeated handling and associated stress. A procedure like this should only be performed by appropriate trained personnel under the approved animal welfare protocol. This is how a small pellet can support long-term experimental studies while minimizing repeated intervention. For highly sensitive mice model, researchers must strictly regulate pellet doses, example low dose, to prevent severe complication. If the pellet is being used to support a tumor model, it should be implanted at a subcutaneous site distant from the tumor xenograft. While commercial matrix pellet are widely used, some protocols involve hand making custom silicone tubes capsule packed with crystalline steroid powder and sealed with a medical grade silicone. Are you planning for an upcoming laboratory study? The common experimental uses are hormone studies, delivering long-term doses of hormones like progesterone or testosterone to support hormone-dependent cancer tumor growth. Disease modeling, continuous administration of substances like insulin in diabetes research. Behavioral and neurobiology research, delivering constant level of compound over weeks or months to monitor baseline changes. Thanks for watching the video.